The responsibility to prepare counseling students in an age of artificial intelligence lies primarily with the supervisors and counselor educators of the counselors of tomorrow. Artificial intelligence is becoming increasingly integrated into the counseling field, and it's important for us as supervisors and educators to have a good understanding of what artificial intelligence is and how to integrate it. In the last 2 decades alone, mental health counseling has increased in remote access and technology in a variety of ways, including use of artificial intelligence. Our counselors that we are teaching and supervising are going to encounter this a lot as they work in the field. So it's important that we understand what artificial intelligence means. If we break that down into the two definitions of those words, artificial means involving mechanics, electronics, or computers, as well as synthetic or human designed things rather than something found in nature. Intelligence means the ability to accomplish complex goals. And our clients and supervisees are already using things with AI integrated into them. There are apps like Wobot and Ellie that are currently being used. There's the integration of information to complete assessments and monitor progress currently. And we also use AI to help support diagnoses of our clients that we're giving them. Not only this, but there are some additional potential benefits to AI. It can also analyze transcripts and audio to identify patterns, highlight themes, and suggest areas of growth. This is directly related to supervision, as this is what we're doing. AI can also integrate assessments like PHQ-9 and GAD-7 in sessions and ease the counselor workload by writing notes from the session. It does have a lot of benefits, but that's not to say that there is nothing to be cautious about with AI. The fact is, there's not been much research on the benefits of integrating AI into a counseling setting and how it can effectively be used. And many clinicians are still skeptical about using AI in treatment because there's a lack of understanding. But our clients tend to be a little bit more comfortable with it. Because of this, we also need to know that AI currently is focused on singular goals, like providing psychoeducation and empowering clients to reach their goals. It doesn't challenge our clients. The concept of transference and its analysis and therapy cannot be replicated with AI, which means that it can't deliver effective treatment. Another problem with AI is the idea of bias. AI-based recommendations can discriminate against some members of society disproportionately. The programmers who are creating algorithms that AI uses don't work in a social vacuum, and there have been many instances in which their models have been used to inform judgments about people, like criminal sentences, credit scores, and race, and even zip code. Clinicians need to be or seem to be evenly split on the use of AI tools, whether they should be used or not. Clinicians using AI can potentially fall into misskilling, a concept that suggests learners blindly entrust inaccurate or biased AI models with reasoning tasks. This is especially true for those learners, the supervisees and counseling students that we're working with. AI has the potential to revolutionize the work that mental health counselors do by analyzing sessions, offering real-time feedback on communication and skills, and allowing an objective analysis of skills for supervision. Counselors need to be aware of the pitfalls and benefits of tools like this, both for the good and for the bad. It starts with literacy. Counselor education and supervision is already lagging behind in this area. Additional training, investments in infrastructure, and changes in existing policies, procedures, and standards need to be made in order to ethically use AI in counseling. It's unlikely to replace counselors altogether because current AI is very narrow in its capability. AI is far from perfect, but improving constantly. It is important for counselor supervisors and educators to know about the risks of using AI to ensure ethical use of it as a tool. It will eventually get to a point where it imitates speech, like the imitation game invented by Alan Turing, one of the founding fathers of AI. We're not there yet, but we do need to keep that in mind. AI can be used in a variety of ways and using it in supervision can be beneficial when used correctly, but it's up to us as supervisors and counselor educators to use this technology effectively. It's important for counselor educators and supervisors to know about AI because early research supports the use of AI skill building in counseling. As supervisors, we are challenged to teach supervisees about AI while also learning about it ourselves. Supervisors are tasked with encouraging their supervisees to use AI effectively in things like diagnosis, for example. They should use AI to support their diagnoses by entering objective information to confirm that what they already suspected about a client. At the institutional level, we should advocate for integrations of AI competencies in counselor preparation and suggest the development of training standards related to digital health and AI literacy. This is directly related to our counseling students. The Association for Counselor Education and Supervision supports the thoughtful and ethical use of artificial intelligence as a supplemental tool in clinical supervision while maintaining that human judgment and professional responsibility are maintained. AI may assist with things like transcripts and identifying themes, but supervisors are still responsible for interpreting this information. ACEs also promotes literacy, critical thinking, and ethical use of AI. Clinicians must use caution when using AI in counseling. AI still has inherent bias to it. A study was done using AI to diagnose fictional patients, for example, with a variety of mental health disorders and explicit and implicit racial biases. The AI that was used raised significant concerns about its ability to appropriately diagnose. We as clinicians must serve as stewards for the well being of our clients, beginning with standards of competency. In order to practice this ethically, more research is needed on the efficacy of AI tools and interventions. AI is not going anywhere, and it is important that we advocate for these things so that we can use them ethically. Consider serving on AI related task forces, committees, or work groups. Consider submitting resolutions for position statements to the ACA, ACES, state counseling associations, or the NPCC. Provide public comments during standard revisions. AI is already here and being used in counseling. AI presents both opportunities and risks. Supervisors have a crucial role in shaping the future of AI and counseling integration. Thank you.